Egypt in 1923, the site where King Tut's tomb was found. Such a find then was very, very important due to the fact that it was the first tomb to be completely intact. And they had little knowledge of our dead pharaoh here, and they had little knowledge of how their discovery would impact the way they researched. They would investigate this past, and they would investigate the way King Tut died. Now, as they run about excavating and investigating and other types of aidings, they lack a certain care. This results in a few mishaps with King Tut's body. Some bones may have been broken. Whoops. And that theory would affect some of the theories we will discuss later.
How'd you get so funky?
He was murdered by I.
The first theory was that I, the guardian of King Tut, killed him because he was losing a lot of power to this boy, and he was not going to stand for it when Tut would grow older and toss him aside. As a priest of high standing, it was not cool. They had basic autopsies that kind of brought on this theory. Why these theories are incorrect. A second look at King Tut's body would show that a lot of his injuries noted as cause of death were inflicted after he died. This would obviously be problematic for those who theorized his murder. In 1968, they re-examined the body using X-ray technology. In the X-rays, there was a noted abnormal density at the base of his skull. This would suggest that he had fallen. Another theory was that he died due to sickness, that he died of malaria. There was a possible leg fracture and a weakened immune system that led to infection. DNA tests and CT scans prove that of Plasmodium falciparum, a protozoan parasite that causes malaria in humans. This parasite has been found in many other mummies as well. It was very common to get sick, and a lot of times medicine wasn't advanced enough to keep the sick person alive. Along with other health issues, it also was proven that Tut suffered from a toe malformation known as oligodactyly. This condition made his foot swell and would have caused excruciating pain when he walked. This could have been one of the factors in his death.
3,000 years ago he governed as a sovereign.
The last theory was that he suffered from physical disabilities that led to his death. It was shown in ancient drawings that Tut was shooting arrows, not standing but sitting in a chariot. This was unusual. And also in his tomb they found 100 walking sticks. Originally they believed it to represent power, but then they saw ancient crutches that he obviously used. He could barely stand on his own. Along with that, radiological and genetic testing shows severe curvature of his spine. This could have led to any number of accidents that would lead to his sudden and unfortunate death.
I am a paleontologist.
Currently, the most common belief of his death is that he died due to an infected leg fracture. This is both plausible and proven through the CT scans that were done in 2005, and as far as any other theory goes, most of them are plausible. However, the theory about his murder is highly unlikely. There shows little evidence of foul play or a struggle or something other than a freak accident that would have killed King Tut. There will always be a place for hand-picked trowels and soil sifters, but modern archaeologists use microscopes, X-ray machines, and DNA, along with chemical analysis. King Tut was also researched by medical scientists using state-of-the-art CAT scans to perform radiological analyses.
bursting through a blood-red sky, a slow landslide, and the world we leave behind. It's enough to lose your